Good morning, everyone. I'm thrilled to welcome you all today. We're here to discuss an important and exciting topic: enhancing surgical capacity and sustaining high-quality, safe surgical care. This presentation is brought to you by the Ethiopian Association of Anesthetists. Over the next few minutes, we'll explore strategies to improve surgical services in Ethiopia, ensuring they are safe, high-quality, and sustainable. So let's get started. Welcome to Slide 2, where we explore who we are as the Ethiopian Association of Anesthetists. Founded in 1984, we have grown into a vital organization dedicated to advancing anesthesia practice in Ethiopia. Our organizational structure is designed to ensure effective governance and broad reach across the country. We operate under a board-led governance system, which provides strategic direction and oversight. This helps us stay focused on our mission and adapt to changing needs. We also have 10 chapter offices scattered throughout the country, allowing us to have a local presence and impact in different regions. Our 9 standing committees work on specialized initiatives, from education to policy development, ensuring that we address various aspects of anesthesia care comprehensively. Moving on to our key departments and facilities, our executive office is based in Addis Ababa, serving as the central hub for our operations. We also have a dedicated research center, a state-of-the-art G+3 building, where clinical research and excellence are prioritized. Additionally, our continuing professional development center helps us keep our members updated with the latest knowledge and skills. As a professional community, we have over 2,000 registered and active members, which represents about half of Ethiopia's anesthesia workforce. This gives us a strong, unified voice in advocating for our profession and improving patient care. Finally, we believe collaboration is essential. We work with more than 10 organizations, both locally and internationally, to build partnerships. These collaborations help us advance anesthesia care, education, and policy, ultimately benefiting the broader healthcare system in Ethiopia. All of these elements come together to strengthen our organization and support our ongoing mission. In 2021, the total SAO workforce across 172 hospitals was 2,312, including 657 surgeons, 334 OB-GYNs, 331 IESOs, and 990 anesthetists. When we look at the bigger picture, the overall surgical workforce, or SWF, was 6,747, which includes surgeons, anesthetists, and other specialists. Now, despite these numbers, the SAO provider density remains quite low. In 2021, it was about 5.2 providers per 100,000 people, which is significantly below the LCOGS target of 20. This gap highlights how much work is needed to meet the recommended standards. Another important point is the urban-rural imbalance. Over half of the surgeons, more than 50%, are concentrated in Addis Ababa, leaving rural and underserved regions far behind. This uneven distribution limits access to essential surgical care for many communities. Fortunately, there's ongoing effort through the SA-LTS-II initiative. This national program aims to expand the workforce, improve how providers are distributed across regions, and build up training capacity, all targeted to be achieved by 2025. These steps are critical as we work towards strengthening our surgical system and closing these gaps. Over the past decade, we've seen an incredible growth in Ethiopia's surgical workforce. In fact, there has been a 14-fold increase from around 480 professionals in 2013 to over 6,700 projected by 2025. That's a remarkable expansion, reflecting significant efforts to meet the country's surgical needs. Specifically, the number of surgeons has doubled, from about 180 to nearly 2,700. This growth was driven by expanded residency programs and retention strategies, which are crucial for building local capacity. Another key development has been in anesthesia services. The number of anesthetists increased from roughly 258 to 4,000, primarily through task sharing with non-physician providers. This approach has been essential in scaling up anesthesia coverage across the country. And perhaps most notably, the introduction of surgical officers, or IESOs, has transformed access to surgical care in rural areas. Their numbers went from almost zero to over 400, enabling district-level surgeries and bringing essential services directly to underserved communities. All these efforts highlight a comprehensive approach to strengthening Ethiopia's surgical system, aligning with the broader goal of expanding access and improving health outcomes across the country. Let's take a closer look at the anesthesia workforce production. As you can see, there is a severe workforce shortage. Currently, there are only 258 anesthetists serving a population of over 90 million people. That's an incredibly small number considering the vast demand for safe surgical and anesthesia services. One of the main reasons for this shortage is the limited training pipeline. Right now, only 2 universities are offering anesthesia training programs, and their annual intake capacity is less than 30 students. This means that each year, only a tiny fraction of new anesthetists are being trained and added to the workforce. This limited training capacity creates a critical gap in access to safe surgery and anesthesia across the country. It's a significant challenge that directly impacts patient safety and the quality of healthcare. Overall, this slide highlights a key barrier we face in strengthening our healthcare system. Without expanding training and increasing workforce numbers, meeting the growing demand for surgical care will remain a major challenge. Let's take a closer look at the surgical volume growth in Ethiopia from 2013 to 2023. Between 2013 and 2019, we saw an impressive tenfold increase in surgical procedures, rising from about 43 to 465 per 100,000 people. This rapid growth was largely driven by the SA-LTS, a national surgical plan, which focused on expanding access and improving surgical capacity across the country. However, in 2020, the COVID-19 pandemic caused a significant setback. Due to disruptions from the pandemic and internal conflicts, the number of annual surgeries dropped sharply to around 192 per 100,000. This was a tough period, but it also highlighted the resilience and the importance of strengthening our health systems. Since then, from 2021 to 2023, we've been on a gradual recovery trajectory. Under the SA-LTS II program, surgical activity has been steadily rebounding. We're seeing increased regional coverage and the deployment of mobile surgical teams, which are helping to reach more communities and improve access. Looking ahead, Ethiopia remains committed to scaling up surgical capacity. The goal is to meet global targets for safe and accessible surgery by 2030. This ongoing progress is vital for improving health outcomes and ensuring that quality surgical care is within reach for everyone. Let's take a closer look at the surgical workforce. This slide highlights the importance of understanding the composition and distribution of surgical professionals worldwide. The surgical workforce is a critical component in delivering quality healthcare, especially in addressing unmet surgical needs. It's essential to recognize that there are significant disparities in the availability of surgeons, anesthesiologists, and surgical nurses across different regions. These disparities directly impact patient outcomes and access to timely surgical care. By examining these factors, we can better understand the challenges and opportunities for strengthening surgical systems globally. Ultimately, investing in our surgical workforce is a key step towards achieving better health outcomes and equitable care for all populations. Let's take a closer look at the surgical volume growth in Ethiopia from 2013 to 2023. Between 2013 and 2019, we saw an impressive tenfold increase in surgical procedures. Specifically, the number of surgeries per 100,000 people went from about 43 to 465. This remarkable growth was largely driven by the SA-LTS, a national surgical plan, which focused on expanding access and strengthening surgical services across the country. However, in 2020, like many places around the world, Ethiopia experienced a significant setback due to the COVID-19 pandemic. Surgical activities dropped sharply, with annual surgeries falling to around 192 per 100,000. This decline was caused not only by the pandemic itself, but also by internal conflicts that further disrupted healthcare services. But the story doesn't end there. From 2021 onward, Ethiopia began to recover gradually. Under the SA-LTS-II initiative, surgical activity started rebounding, with efforts to increase regional coverage and deploy mobile surgical teams. This approach is helping to bring surgical care closer to underserved communities. Looking ahead, Ethiopia remains committed to scaling up surgical capacity. The goal is to meet global targets for safe and accessible surgery by 2030. This ongoing progress highlights the country's dedication to improving surgical services and ultimately, health outcomes for its people. Now, let's look at the strategic leap we're making with a strong national commitment to scale, covering the years 2024 and 2025. One of the most significant steps has been the massive expansion of our training infrastructure. We are now working with 32 higher education institutions that are actively training our anesthesia workforce. This expansion is crucial because it increases our capacity to produce skilled professionals across the country. In addition to expanding infrastructure, we're seeing an exponential increase in the production of anesthesia workforce graduates. We're now producing nearly 600 new professionals annually, which is a remarkable achievement. To put that into perspective, this represents a 20-fold increase in graduate output compared to 2014. This rapid growth is essential to meet the increasing demand for quality anesthesia services nationwide. It's a testament to how committed we are to strengthening our healthcare system and ensuring that more people have access to safe and effective anesthesia care. Overall, these initiatives are key to scaling up our efforts and making a substantial impact on healthcare delivery across the country. Now, let's look at some of the key results we've achieved in building a high-quality, high-impact workforce. First, in terms of increased access to care, our current workforce density stands at 3.6 anesthesia professionals per 100,000 people. While there's still room for growth, this is a significant step forward in reaching the targets set by WHO and the Lancet Commission, which aim to improve access to essential surgical and anesthesia services worldwide. Next, on the quality front, we're proud to report that our national license exam pass rate has consistently stayed above 90% over the past decade. This is a strong indicator that we're maintaining high standards and ensuring that our anesthesia professionals are both competent and well-standardized across the board. All of these efforts reflect our overarching goal, to develop a workforce that not only meets the demand, but also provides safe, reliable, and high-quality care. It's about making a real impact on health outcomes and moving closer to universal health coverage. Today, I want to highlight the Ethiopian Association of Anesthetists and reflect on a significant milestone, a decade of transformation. Over the past 10 years, we've seen remarkable growth and development within our organization. This period has been marked by improvements in training, increased professional standards, and a stronger sense of community among anesthetists across Ethiopia. We've worked hard to elevate the role of anesthesiologists, ensuring they are recognized as vital contributors to healthcare delivery. This transformation aligns closely with our broader goal of enhancing patient care and safety. Looking back, these changes have laid a solid foundation for future progress, empowering us to continue advancing anesthesia practice in Ethiopia. It's a testament to the dedication of our members and the support of our partners. This decade of growth truly exemplifies our commitment to excellence and innovation in our field. Today, I want to highlight some of our key efforts in driving workforce development and improving quality in patient care. We've built a truly competent workforce from the ground up by co-developing 4 national competency-based curricula that span from level V through BSc, MSc, and PhD. This comprehensive approach ensures that our professionals are well prepared at every stage of their education. In addition, we've trained over 2,400 anesthesia tutors and preceptors, who play a crucial role in mentoring and maintaining high standards. To support this ongoing development, we also established a dedicated research and training center, which serves as a hub for continuous learning and innovation. Moving to quality and safety, we've developed national anesthesia guidelines and standards to ensure consistent, high-quality care across the board. Evidence has shown that higher scores on licensing exams are linked to safer patient outcomes, reinforcing the importance of rigorous training and assessment. Finally, we've launched targeted quality improvement projects, such as initiatives aimed at improving outcomes in breast cancer surgery. All these efforts are part of our broader commitment to elevating patient safety and care quality through workforce excellence and continuous improvement. Let's take a closer look at how we're strengthening regulation and establishing continental leadership. One key aspect is actively participating in the national licensing process. This ensures that every graduate meets the necessary competency standards before entering the field. Additionally, we're committed to continuous professional development. That's why we provide over 6,000 free online CPD courses, making it easier for professionals to keep their skills sharp and up to date. We also host annual conferences. Our 18th is scheduled for 2025, where experts gather to share knowledge and best practices across the continent. These events foster collaboration and innovation. Turning to Ethiopia, we can see a remarkable example of leadership. Over the past decade, the Ethiopian Anesthesia Association has transformed the country from facing a critical shortage of anesthesia professionals to becoming a major producer of trained experts for Africa. This systematic, strategic approach serves as a model for health workforce development throughout the continent. It shows how dedicated efforts and strong leadership can create sustainable change and inspire others to follow suit. Let's take a moment to talk about the EAA-IRB. The EAA, or Education Abroad Administration, works closely with the Institutional Review Board, or IRB, to ensure that all research involving human subjects is conducted ethically and responsibly. The IRB's main role is to review research proposals to protect participants' rights and well-being. It's important to understand that any study or project involving human subjects must go through this review process before it can begin. This helps us maintain high ethical standards and comply with federal regulations. In the context of education abroad, this means ensuring that research conducted overseas adheres to the same ethical principles we follow here, such as informed consent and confidentiality. Connecting this to our overall theme, it highlights the importance of ethical oversight in international research, which is vital for maintaining credibility and protecting both our participants and our institution. So always remember, the IRB is there to safeguard everyone involved and to uphold the integrity of our research efforts. Now, let's turn our attention to the impact of these advancements on surgical outcomes and quality improvement. One of the most exciting developments in recent years has been the rise of enhanced recovery after surgery, or ERAS. This approach represents a significant shift in how we manage patients before, during, and after surgery. The goal is to optimize recovery, reduce complications, and shorten hospital stays, all while maintaining or even improving the quality of care. ERAS protocols involve a multidisciplinary effort, integrating evidence-based practices such as minimal fasting, optimal pain control, early mobilization, and nutritional support. These strategies work together to enhance the patient's natural healing process. What's particularly important to note is that ERAS has been shown to improve outcomes across various types of surgeries, from colorectal to orthopedic procedures. It's a perfect example of how continuous quality improvement and innovation can lead to better patient experiences and results. Overall, the rise of ERAS underscores the importance of combining clinical expertise with structured protocols to elevate the standard of surgical care. It's a testament to how ongoing research and collaboration can truly transform outcomes for our patients. Now, I'm excited to share that EAA is currently implementing ERAS protocols across 10 high-volume hospitals. This is a significant step because it demonstrates our commitment to expanding enhanced recovery efforts on a larger scale. By focusing on these busy hospitals, we're aiming to make a real impact where it's needed most. The goal here is to streamline recovery processes, reduce complications, and improve patient outcomes across these facilities. It's about standardizing best practices and ensuring that more patients benefit from the advantages of ERAS. This expansion aligns perfectly with our overall theme of improving surgical care through innovation and collaboration. It's a big move toward making enhanced recovery a routine part of surgical care in many more settings. Today, I'm excited to share with you a significant milestone in our journey, our PhD in anesthesia and critical care. This marks a new era in education, as we've successfully launched the nation's very first PhD program in this specialized field right here at the University of Gondar. It's a groundbreaking achievement that positions us at the forefront of advancing anesthesia care. Currently, we have over 10 pioneering candidates enrolled in the program. These talented individuals are not just students, they are shaping the future of our specialty, driving innovation and excellence in critical care. What makes this even more remarkable is that Ethiopia is now the only country in Africa offering a PhD in anesthesia and critical care. This achievement positions Ethiopia as the undisputed academic leader for this field across the continent, highlighting our commitment to advancing medical education and research. Looking ahead, our vision is truly continental. We're building a center of excellence dedicated to training the next generation of physician scientists. We're open to collaborating with physicians and allied health professionals from other African nations. Our goal is to work together, learn from each other, and elevate anesthesia care across Africa, making a real difference in patient outcomes and healthcare quality. Let's take a closer look at the key workforce density matrix. Here, we see some important metrics that help us understand progress and gaps in surgical care. Starting with surgical volume, in 2015, before the SA-LTS program, Ethiopia performed about 43 procedures per 100,000 people. Fast forward to 2021-2023, and that number has increased significantly to 189 procedures per 100,000. While this is a notable improvement, it's still far below the Lancet Commission's 2030 target of 5,000 procedures per 100,000. Next, the specialist surgical workforce. In 2015, there was roughly 0.5 specialists per 100,000 people. Today, that number has grown to over 5, reaching 5.19. And the goal is to get to 20 specialists per 100,000 by 2030, so we're making progress but still have a way to go. Finally, workforce retention shows a positive trend. The percentage of surgeons practicing in Ethiopia increased from about 44% in 2015 to over 75% in recent years. This indicates better retention and engagement of our surgical workforce locally. Overall, these metrics highlight significant progress, especially in workforce retention and surgical volume, but they also remind us of the substantial gap that remains in reaching global targets. It's a clear call to continue strengthening our surgical systems and workforce to improve access and quality of care for our population. Let's take a closer look at the anesthesia workforce distribution across the SALT periods, which include the pre-SALT, SALT 1, and SALT 2 phases. As you can see here, this slide highlights how the number and distribution of anesthesia providers changed over time, especially in response to the SALT campaign initiatives. During the pre-SALT period, before any interventions, the workforce was relatively stable, but there were some gaps in coverage. Moving into SALT 1, you can notice shifts. These might reflect initial efforts to optimize workforce deployment or training. And then, in SALT 2, there's often a further adjustment, indicating how strategies evolve to meet the demands more effectively. Understanding these patterns helps us see the direct impact of our interventions and how workforce planning adapts over different phases. It also underscores the importance of continuous monitoring and flexible strategies to ensure we maintain quality care throughout each stage. Overall, this distribution data is key to understanding our progress and guiding future workforce planning efforts within the context of the SALT campaign. Building a Pan-African hub for anesthesia and critical care research and training is a bold and necessary step forward. This initiative aims to create a centralized platform that brings together experts, researchers, and trainees from across the continent. The goal is to foster collaboration, share knowledge, and accelerate advancements in our field. By establishing this hub, we're not just improving individual practices, we're strengthening the entire healthcare infrastructure in Africa. It aligns perfectly with our overall mission to enhance patient outcomes and build sustainable local expertise. Ultimately, this hub will serve as a catalyst for innovation and capacity building, empowering us to address the unique challenges we face in anesthesia and critical care across the continent. Welcome to the final slide, which highlights the East African Journal of Anesthesia and Perioperative Medicine. This journal plays a crucial role in our field by serving as a dedicated platform for research, reviews, and case studies relevant to anesthesia and perioperative care specific to the East African region. It's important because it helps disseminate regional data and insights, which can sometimes be underrepresented in global literature. This, in turn, supports the development of context-specific best practices and guidelines, ultimately improving patient outcomes locally and regionally. By focusing on the regional challenges and innovations, this journal encourages collaboration among healthcare professionals in East Africa, fostering a community of shared knowledge and continuous learning. So, integrating regional publications like this into our broader understanding is vital for advancing anesthesia practice in diverse settings, ensuring we are addressing the unique needs of our populations while aligning with global standards. Looking ahead, our focus is on collaboration and transformation. We recognize that building strong partnerships is essential to strengthening anesthesia and surgical systems across the continent. By working together with diverse health sectors, we can foster transdisciplinary collaboration that brings innovative solutions to complex challenges. Our efforts are centered on developing a sustainable healthcare workforce, which is the backbone of lasting change. We're also committed to advancing surgical and anesthesia care through innovation and digitization, leveraging technology to improve access, quality, and safety. Ultimately, our goal is to transform African healthcare through a shared vision, one that emphasizes equity, safety, and excellence for all. I invite you to join us in this journey as we work together to advance safe and equitable care across Africa. Let's make this vision a reality together.